Anxiety Treatment Plan by
Lauren,
Abby,
Ashley,
and Olivia.
We've made an anxiety treatment plan for children and youth. We've split it into 4 different age groups, and they each have their own activities and their own resources.
The intervention for children ages 4 to 6 that we chose with anxiety is a sensory box. The materials that are needed is a box and textured items such as Play-Doh, a stress ball, pine cones, beads, bouncy balls, leaves, sponges, etc. Each sensory box is going to be different depending on their level of anxiety, their age, and their allergies. Using a sensory box would give the child or youth something to concentrate on and focus rather than their anxiety. The different types of textures and smells can help the child or youth vocalize how the object smells, feels, and sound rather than being unsure of how to vocalize what is happening in their minds. A sensory box is effective because they no longer are focusing on what's troubling them, and they can take part in affect regulation activities, which would then calm their nervous system down.
For children ages 7 to 9, the intervention that we chose is called the anxiety jar. The materials that you need are a jar, vase, or a box, paper, and a writing or coloring utensil. Ask the child to find a spot in the room where they feel comfortable and relaxed. They're going to need 2 pieces of paper. On the first paper, ask them to write or draw how they feel during times of anxiety. Give them a few minutes to do that. Then encourage them to think of their triggers and ask them to draw those as well. Once they've finished that piece of paper, ask them to take the second one. On the second one, they are to write down if they feel there are ways that they can prevent anxiety feelings from happening. Always be sure to make sure that the child is emotionally safe. After they've finished writing on the 2 pieces of paper, discuss with them how they feel. Once they're finished, both pieces of paper, get them to write on the first piece of paper how they feel now that they're about to crumple it up. Then once they do that, crumple the piece of paper up and stick it in the jar. At the end of the day, or week, whichever you choose, have a little ceremony with them of throwing out those feelings of anxiety. Once you're finished throwing them out, have a little discussion how it makes them feel now that those feelings are gone. This activity is good because it replaces the anxiety and it also helps them to find ways to think of something else during times of anxiety.
At this point in their lives, children in the age group from 10 to 12 are generally in hormone overload. This is because of puberty. So because of this, many of the things that would generally seem really small and insignificant seem huge and overwhelming, which can be scary and cause anxiety. So this is generally when they worry about like school and friends and family, which can cause like panic attacks and all that kind of stuff. So because children in this age group get embarrassed really easily because of the hormones, we decided to use an activity that doesn't really involve a whole lot of movement, doesn't involve anything that might embarrass them. They just close their eyes and they breathe. That's all it is. So it's called Breathe. And what they do is they just sit down, and it can be done one-on-one or in a group. They sit down, they close their eyes, and they take a deep breath in, and they count 1, 2, 3. And then they breathe out, and they count 1, 2, 3, 4. And so on and so forth until whenever they feel calm, they can like stop at a specific number, like 7 or 8, or they can keep going until whenever they feel like it. And as soon as they feel calm, like during it, it gives their brain a little bit of time to kind of restore itself and maybe find a solution. But as soon as they're done and they're calm, their caregiver or their adult or teacher, whoever is doing it with them, can talk to them about whatever's making them feel anxious, can help them find a solution. So the reason why this activity is really good is because anxiety can make it really, really difficult to breathe. It can make chest pains, and it can just like cause breathing problems, which is never good, and it makes it more difficult to calm down. So focusing on breathing and taking deep calming breaths can take their mind off of it. And a bonus to this is that it can be done literally anywhere. They can be walking down the street or doing whatever, and they start to feel panicky and a bunch of anxiety, and all they have to do is start breathing. They don't even have to close their eyes. They can do it while they're still walking. So they just breathe in, and then they can figure it out, and they can carry it on until they're adults. They can use it throughout their life. They can teach it to their kids, and it's a healthy way to deal with anxiety rather than doing whatever else.
Okay, so to help youth ages 12 to 15 overcome anxiety, we chose the activity called the Fear Ladder. So first of all, you're going to have the child make a list of the situations, places, or things they fear. The next step would be to actually make the fear ladder on a scale of 0 to 10, with 0 being no fear and 10 being tons of fear. This helps them to identify how much fear they have for a specific situation. Now the youth should pick one situation to start working on, usually the one that makes them the least anxious. For example, a fear of germs. You could try touching a doorknob every day without having to wash your hands right after. Move on to the next situation until you have successfully completed your fear ladder. By writing it down, it is no longer just in their head. It gives them a tool to work with. This activity can be used time and time again. If the fear resurfaces, they need to start their exposure exercises. The fear ladder can be brought out, however, they may need to reevaluate the items on their fear ladder. Dealing with anxiety is lifelong, and having the necessary tools at hand will help make things easier over time.
The Ontario Early Years Centre is run by the YMCA. It's funded by the government, and it's located in Bowmanville. It's a resource dealing with children from ages 0 to 6. The YMCA's purpose is to help parents and guardians know what the child's needs are for the first 6 years because the development is very important at that time. It's for parents and guardians and the child to participate in different activities and programs.
Kinarkin Child Family Services is located in Peterborough, Ontario. They offer counseling for families and children ages 7 to 9 who struggle with anxiety.
The resource that we chose for children ages 10 to 12 is Peterborough Youth Services. They do individual, group, and family counseling. They are a non-profit organization. You don't need a referral. You can just call and get an intake appointment and then get a counselor. Your doctor can also refer you or your youth counselor or your residential home. They are located in Peterborough.
The resource we chose for children ages 12 to 15 dealing with anxiety is the Family and Youth Clinic located within the Peterborough Regional Health Center, with the focus being on service to individuals whose day-to-day functioning is significantly impaired due to anxiety.
Thank you for listening to our intervention plan.
I feel like we